So hi guys and welcome to this MEDCATALYST classes. So in this session we are going to discuss about one of the most important topic, that is like developmental milestones. Like milestones are very important. You will be getting each one question from each shift. In NORCET exam they will be keep on asking, and frequently they will be asking most of the questions which are related to the milestones. So that you should know about each and every milestones, when it will come and all. So I will be teaching in very fun and in an interesting manner, like by through using the pictures and all. So most of you have seen this, they will be teaching in gross motor, fine motor, and like language motor, language developmental and all. So like first we will discuss about our discussion. Like first we will study about what actually happens in these milestones, how it will occur and all. So like let's discuss now with milestones. Like trust me, if you listen this discussion for carefully, like you won't be able to make a wrong in these milestones, I can assure you that. So let's begin now. Look at the image carefully over here. So how the baby is looking over here. No, look at the baby. At the age of the baby is 1 month. At 1 month, okay, the baby is giving just looking to the mother itself. No, she is not smiling. So mother is smiling, but the baby is not at all smiling over here. So that's why baby is very boring over here. So that's why like the baby is just visual fixation. No, visual fixation, it comes under 1 month. Okay, like look at the mother is smiling but baby is not smiling. Baby is very boring over here, and later on baby will think that if I be that much boring, nobody will speaks with me, nobody will talks with me and all. No, so that's why baby will develop some little bit smile, that is known as social smile. Okay, social smile, that is known as social smile, when it will come under 2 months. Okay, these are about milestones which come under 1 month and 2 months. And next we move on to the 3 months. At 3 months, what will be happen? Now the baby is staying with the mother, so that's why baby can recognize the mother. And baby will start cooing. No, here also CO is present. No, at 3 months, and here also cooing. No, so remember like this. And next is like neck holding. Neck holding also comes under 3 months, right? And one more important thing, this I will teach in your neonatal reflexes also, like palmar, grasp, reflex, they will disappear at 3 months. Okay, and these are all the milestones which comes under 3 months. And next, this is about 4 months milestone. So look at the 4 months over the baby over here. At the 4 months, like baby is holding the objects in the two hands, that is known as bidextrous approach. So for 4 we can write 2 into 2. No, remember like this, 2 into 2 for 4. 2 into 2. For 2 we call it as bi. No, 1 2 it stands for bidextrous approach. Bidextrous approach. One more 2 it stands for binocular vision. Okay, very important. No, so after holding the object in the hand, the kid won't be like quite, no, it will put into the mouth, that is known as mouthing. Look at over here, this diagram, how the hands of the baby she is putting inside the mouth. No, so this is known as mouthing. Mouthing comes under 4 months. Bidextrous 4 months. Mouthing. Okay, and look at this diagram carefully, what the baby is trying to roll over. No, so that is roll over comes under 4 months, like roll over. Okay, and laughing, this is very important. No, most of the parents, they will feel very happy when the baby will laugh. No, so that comes under 4 months. Don't confuse with social smile. No, social smile is different and laughing is different. And next is pulls to sit. No, and here there is no head lag. These are all the milestones which comes under 4 months. Okay, and next we move on to the milestones which comes under 6 months. 6 months. At 6 months, child is very independent. No, she want to be in a single itself. No, he don't want to mingle with others, so they will be staying in the single itself over here. So what the child will do? The child now look into the mirror. He can play alone now. So that's why mirror play. Look at the child over the here. No, he is looking into the mirror very cutely and he is playing by himself only. And next is like I told you, single unidextrous. No, unidextrous is nothing but the child can hold the objects in the single hand, and he can, by the holding the single hand, he can transfer into the other hand also. So that's why transfer objects will also comes under 6 months. And one more thing is monosyllabus. No? All which are related to the single only. No, mirror play single, unidextrous single, monosyllabus is also single. And next is tripod position. Okay. And one more thing is like stranger anxiety. Stranger anxiety. When does the stranger anxiety comes? Under 6 months. Okay. And child will listen to no. If you tell the child don't do nothing, like he cannot uh, completely no, but he'll tell listen to no comes under 6 months. Okay. And here it is also very important. And so tripod position like sits with support. These are all the milestones which comes under 6 months. And next I will move to the 9 months. No, 9 months, like remember a story like immature boyfriend and girlfriend, like they are both are immature. So that's why they'll what that is like immature pincer grasp. There is a boyfriend and girlfriend, they both are immature, so they have a breakup and they will tell bye bye to each other. Okay. After they want permanent, no, like they want an permanent, so they want their own way, so that's why there is an object permanence over here, like. And next it's like sits without support. Okay. And next is like crawling and clapping will also come over here. Crawling and clapping. And bye bye and bye syllabus. So what do you mean by this bye syllabus? Is like mama, papa and all. No, the and all they will come under this bye syllabus, not under monosyllabus. Is nothing but only two words, ma, ba and all, M-A-B-A and all. No. So this is about 9 months. What are immature pincer grasp is like? So look at the pen over here. Like if you give anything to the baby can hold the object like this. No, that is known as immature pincer grasp. Will comes under 9 months. And next we move to the milestone, that is like under 10 months. What they will come? Look at the carefully. So what the mother and child they are doing? They are playing peekaboo game. No, this is the peekaboo. Okay. And next creeping will come over here. Look at the child standing with the support, no, in this diagram comes under 10 months. Standing with support. Okay. And next, these are all very important. And pivots and cruises. So what do you mean by is like baby will start to change the direction. No, this is like this. Like this is known as pivots. Like baby will also start the changing the direction. When does this comes under 10 months? So these are all the milestones which comes under 10 months. And next is like look at this carefully. So these milestones will comes under 12 months. No? What it will come under 12 months? At first birthday, the baby 12 months is nothing but their first birthday. The baby will be very mature over here. No? Mature pincer grasp. No? Mature pincer grasp will come over here and mouthing will disappear. Mouthing will disappear over here. Comes, the baby will comes when called. Comes when called. Baby will comes when you call, and the baby can throw a ball also over here. No, baby will come when you call, and the baby can throw a ball over here. Throw a ball, right? And next casting will also come over here. okay, and stand with, here look at over here, standing with support is 10 months. At 12 months, look at the baby standing without support. Look at the image carefully. So these are all comes under 12 months. Stand without support, okay. And remember 12 months, no, you can write it like this also, no, two words. When can a baby can tell 1 to 2 words? At 12 months. Remember, at 12 months, 1 to 2 words, okay. These are all very important milestones, you should know each and, so that's why milestones are very important. Like, if you listen to this class, I taught you know all the questions you can answer, so I will solve you in front of you. No, these are all the milestones which comes under 12 months. Like mature pincer grasp mouthing comes when call, you're calling the baby and you're telling the baby to throw a ball. Remember, like this, calling the baby, throwing a baby the ball, and like stand without supports. And 12 I can write it as 1 to 2, no, so that's why 1 to 2 words. This is about 12 months. And next, it's like 15 months. At 15 months, this is at 15 months. At 15 months, what the baby can do? The baby can walk alone. The baby can walk alone, okay. And like jargon will come over here. Jargon speech. Jargon is nothing but like, no, the baby will be having their own language, no, that is known as jargon. Like babies, they will be speaking in their own languages, like something or not, that is known as their jargon. And imitates scribbling, okay. This is about at 15 months. And one more important is like 2 block tower. 2 block tower at 15 months. These are all the milestones. The baby can walk alone, jargon will come, and scribbling, and 2 block towers, okay. These are all about milestones which comes under 15 months. At 18 months, no, at 18 months, the baby is bit active. Domestic mimicry. If the mother will tell the baby to not to enter into the room, even though the baby will enter the room and they open the drawer. Explores. So remember, like this, the mother has told the kid to not enter into the room. So the, even though the kid has entered the room, that is domestic mimicry. And like after entering the room, the baby started opening the drawer, explore the drawer, and the baby started unzipping over there, no, and the mother gave a kick, and mother slapped the kid, and the kid is very angry, so he went out, so he ran out, and he kick a ball. He kick a ball, no, look at the diagram over here, no, the baby ran out and he kick a ball, and now the kid is very independent, so he is very angry, so he feeds on spoon by his own, no, and he will ask like dry during day is nothing but he is asking where is the washroom is present, no, he can go for toilet, and for toilet asking I should go for toilet and all, no, so that is known as dry during day, okay. And like 18 to 10 words, okay, 18 to 10 words will come at 18 months, right. 8 to 10 words will come under 18 months. And next is tower of 3 cubes comes under 18 months. Tower of 3 cubes. Now you came to understand, no, like an angry kid, he went inside the room, opens the drawer, and he unzipping will comes under 18 months, no, and the mother gave a slap, and he ran out and he kicks a ball, and he is very angry, so that he feeds on spoon, and dry during day he is asking the mother where to go for toilet, and also like dry during day. And like 8 to 10 words the child can speak, and like tower of 3 cubes comes under this 18 months, okay. This is very important milestone. Like what are all the milestones which comes under what year and all, so this is about 18 months. And next, come to this, like, so look at what the child is doing. Drinking and food is also present over here, and here also drinking is also present, so that's why ask for food and drink comes under 2 years. ask for food and drink will come under 2 years. Okay, and next the baby will do like name of an body parts. No, for the baby want to name a body parts, so the baby will name over here naming of body parts. For naming the body parts, the baby has to undress itself. No, so that's why undress completely. The baby add a food and drink, and you ask to name a body parts. To name a body part, the baby has to undress completely and unscrew and doorknobs. So the baby can open the doorknobs and all. That comes under 2 years. And one more thing in the 2 years is very important is two steps up and down. No, two steps up and down will comes under which year? 2 years. Okay, and two word sentence. Two word sentence. I am not using the this line. Look at the over here. 1 to 2 words. I am using this sentence over here. And next, two objects. No, and the child can draw two lines. Very important. Two steps up and down. Two word sentence. Two objects, and the baby can draw two lines. And parallel play. Parallel play comes under 2 years. What do you mean by this parallel play? Suppose imagine two kids are there, no, and the two kids are together, no, and they're playing at their different. Though he will be in their own world and this guy will be in their own world. No, they won't follow the obey and all, right? They will be playing among themselves only. They won't have interaction to each other. So that is known as parallel play. So these are all the milestones which comes under 2 years. And next, look at this milestone over here. This comes under 3 years. So at 3 years, remember not triangle. Triangle comes under 5 years. This is at 3 years tricycle over here. Look at the wheels. Here one wheel is there. Here one wheel is there. And I think, now my image is clear. Here one wheel is there. No, so this is the tricycle. Tricycle at 3 years. At 3 years, tricycle is present over here. And look at how the wheel is there. The wheel is circle in shape. No, the wheel is in the circle. So when can a baby draw a circle? At 3 years. No, one of the exams they can ask like the baby can drive a tricycle at 3 years. No, 3 years tricycle and circle at 3 years. Look at over here. Very important. And next is like handedness comes under 3 years. Comes under 3 years. No, and tower of 9 tower. Okay, 9 tower will comes under 3 years. And next the baby can dress plus undress, and baby can dress and undress completely except buttons. Baby cannot able to put the buttons. Okay, and one more important thing is the baby can know name, age, gender by 3 years. Okay, this is one of the previous year NORCET exam question. Like when this is a very simple. No, when can a baby know his name? They have asked like they have gave this multiple options 3, 4, 1 and all. Like when can a baby know their gender? The gender is known by at the age of, tell me, 3 years. Okay, so this is about 3 years. What are all the milestones will come? And next we move to the one more thing. This one, like one more milestone, like two are left. One is 4 years and one is 5 years. And one more thing in like, no, here I thought, like 2 steps up and down. Here 1 step upwards. So the baby is moving 2 steps upwards and downwards in 2 years and only 1 step upward in 3 years. Okay, and next 1 step downwards. So we will cover starting itself. 1 step downwards over here. Okay, this is very important. Look at the baby over here, no? Like what the baby is doing, like I don't know what game they call it now. This is like hopping, comes under 4 years. Sorry, I will write it over here. This is under 4 years. No? So look at the diagram over here. Here you have this square also, no? This one. This is square. Square. When can a baby draw square? At 4 years. Okay. And cross. When can a baby draw the cross? Also at 4 years. And bridge with blocks. Bridge with blocks. Look at it, looks like a bridge, no, with blocks. So that is also comes under 4 years. And poem and 4 years. Right, baby can tell, if you tell the baby to go the right, the baby can go the right. If you tell the baby to go the left, the baby can go the left. This is right to left discrimination. And toilet alone. So don't confuse. Toilet won't come under 3 years. Toilet will come under 4 years. The baby can go for the toilet alone under 4 years. These are all the milestones which comes under 4 years. And next milestone which I will explain, this comes under 5 years. Look at the what the baby is doing. The kid is doing, no. The kid is doing playing skipping over here, no. To play the skipping, you want to wear the shoes and you should tie the lace. So that's why tying the lace will comes under 5 years. Tie the shoelace. Tie the shoe laces. And what the baby is doing? Baby is skipping. Baby is playing the skipping, no? Look at the diagram, picture carefully over here. Skipping is present in this arm. So to play the skipping, you want to tie the shoelaces. Remember like this. Sorry. And skipping. And the baby can draw a triangle over here. Under 5 years, I thought in starting also I taught you. And next thing is like the baby can ask meaning of words. Okay, meaning of words, and the baby can recognize 5 colors. Okay, so now you know 1 to 2 colors, like remember 1 2 3 colors, no, here at the 3 years 1 to 2 colors, the baby can recognize only 1 to 2 colors at 3 years, 1 2 3, and rest is like for recognize 5 colors at 5 years of an age. Okay, very important. And the baby can make the gate with block. Bridge at 4 years, no, bridge we can make at 4 years, and gate at 5 years. Okay, these are all the milestones which you have to know. Like I have simplified for you so that you can retain it in your memory. Please watch this video carefully so that definitely it will helpful for you. Like at 1 month, very simple visual, baby is very boring over here, so that's why the baby is very bored, and the baby will come to know that if I be this much boring, nobody will speaks with me. That's why baby will smile. That is known as 2 months, no, that is social smile. At the 3 months, recognize the mother, cooing, neck holding, and palmar grasp will disappear. At 4 months, I taught you, no, look at the diagrams. 4 into 2 into 2 equal to 4. Bidextrose, binocular, and mouthing, and roll over, laugh, pull to sit. Okay, at 4 months. And here at 6 months, very simple. Single wala, mirror play, unidextrous, transfer object, and monosilmus, tripod position. At 9 months, bye bye, and immature pincer grasp will comes over here. At 10 months, peekaboo, creeping, standing with supports, pivots and cruises, changing the direction. At 12 months, like 1 year, the baby can throw a ball, comes when you call, mature wala, and stand without support, and 1 to 2 words. Okay. At 15 months, walk alone, jargon, 2 block towers. At 18 months, it's very simple. Domestic mimicry. Mother will slap, he opens the drawer and unzips, mother will slap, run away and kick the ball and feeds on a spoon, dry during day, 8 to 10 words, tower of 3 cubes. Okay. 2 years also same, like food and drink. Remember this 2 2 2 2. 2 steps up and down and 2 word sentences and two objects, draw two lines and parallel play and all over here, right? And next is like at 3 years, tricycle, circle, handedness, towers and all. Okay, these are all very important milestones. So now we'll look into the drawing skills. No, look at this. Imagine a female. She's having something. She's holding something on his head, her head, and this is her abdomen or trunk. So I'm putting plus inside this, and this is her legs. No, so this is draw like this, draw like this, and draw plus symbol and this triangle. No, this is at 2 years. When can a baby draw the straight line? At 2 years. No, at circle 3 years, which I have explained here also. No, at tricycle here, circle also at 3 years. No, plus or square. I taught you here also. No, plus or square, cross, which is nothing but the plus. At which year? 4 years. And triangle at 5 years. Okay, this is very important. So draw with me. So I will draw it one more time for you, so you will get clear here itself. Straight line, circle, plus or a square. These are the legs. 2 years, 3 years, 4 years, 5 years. Okay. So now you came to know when can a baby draw the circle, when can a baby can draw plus symbol or like triangle and all. This is about milestone. And now trust me, we'll go, you just look into over here. Neck holding, I taught you when can a baby hold the neck holding. At baby can recognize the mother and baby will be scary, so that I will get fell down from the mother. So that's why neck holding will come under 3 months. Rollover, I thought you know, like rollover 4 months. I have told you, showed the diagram also. Sits in tripod 6 months. No, sits without support 9 months. I thought you know, like immature and the child will sits without support and all. Sorry. And stands without support at 12 months and walks alone at 15 months. Jargon will also comes under 15 months. Run, I told no, now only I explained. The baby will fight with the mother, he runs away at which months? 18 months. Okay. Walk up, downstairs and 2 feet. Tell me. 2 years. No, 2 feet, 2 years. Rides tricycle 3. No, and alternate feet going upstairs. 1 step upstairs, that comes under 3 years. Hops on a foot, alternate feet going on downstairs at 4 years. No, hopping, I taught you here also. No, hopping. So now you just tell me whether the milestones are easy or not. No, very simple. And next is like bidextrous approach. No, holding the objects in both the hands and 4 months. And unidextrous 6 months. No, immature pincer grasp, immature boyfriend and girlfriend at 9 months. Mature wala 12 months. Irritates, scribbling, tower of 2 blocks, drinks crumb cup. This comes under 15 months. No, okay. And scribbling, tower of 3 blocks, feeds with the spoon. I taught you, no, feeds with the spoon and all, like 18 months. Tower of and 6 blocks, undress, dress and undress completely, tell me. 2 years. Okay. Tower of 9, 3 years. No, 3 into 3. 3 3s are 9. 3 years. Circle, I thought you know for the cycle, look at the wheel of the cycle, how it looks, circle. No, so at 3 years. Copies, crosses, bridge with blocks, bridge, I taught you know, bridge at 4 years. Gate at 5 years. Copies, triangle, gate. Bridge with block 4 years. Gate with block 5 years. Okay, these are all the milestones. And next we move to the social smile. This is very simple. Social smile 2 months. Recognize the mother at 3 months. No, Stranger anxiety, 6 months, no, inhibits to no, way to bye bye, tell me, 9 months, comes when called, plays a simple ball and game, 1 year birthday, 12 months, no, jargon, 15 months, no, points to the object of an interest, copies parent in task, that is known as domestic mimicry, so that's why no mother will slap him, so that is at 18 months. Ask for a food and drink and toilet at 2 years. Share toys, knows full name, age, gender by 3 years. Plays cooperative in a group, goes to the toilet alone 4 years. Hopes in household task at 5 years. Okay. So now these are all the milestones which I have explained earlier also. And alert to sound at 1 month. Coos, I told you no, cooing. Recognize the mother, COO. Here also at 3 months. Laugh loud, I taught you at 4 months. Monosyllabus, single, independent at 6 months. Bisyllabus, bye at 9 months. 1 to 2 words with a meaning, 2 words, no, so that's why it is like 12 months. 8 to 10 words, 18 months. 2 to 3 words at 2 years. Ask a question, 3 years. Sing song or telling stories at poems at 4 years. Ask meaning of the words at 5 years. I hope you guys are clear about all the milestones which I have explained now. So now you guys can make each and every questions which are correct about milestones. Very easy topic. So you should keep on memorizing this one, and next we'll know one of the small topic, that is neonatal reflexes. Very important. So whatever the reflexes that I have mentioned over here, these are all the reflexes, these are present before birth. No? Look at this diagram carefully, first wala. So I think most of you have done these reflexes in your practical and in your home also. No? If you give the baby a hand, no, like finger or anything, so the baby will hold tightly. That is known as palmar grasp reflex. Palmer's grasp reflex. So the question is, when does it appear? At 28 weeks. Okay. And when does this disappear? I taught you there also, like in milestones also, when does this disappear? At 3 months. Okay. This is about palmar grasp reflexes. All these reflexes which I am teaching you, they will appear before birth itself. And one more thing is rooting reflex. What you will do, like if you lick on the baby's cheek, no, the baby is able to know that food is coming, so that's why baby will open the mouth. That is known as, if you encircle it on the cheek of the baby will open the mouth. That is known as rooting reflex. So rooting reflex, when does this appear? 32 weeks. When does this stands for disappear? At 1 month. Remember, this is the reflexes which is early to disappear. Early to disappear. Okay, name the reflex which is doesn't disappear, that I will teach you, that parachute reflex also, right? And next, this is like ATNR. What do you mean by this ATNR? Asymmetrical tonic neck reflex. Okay. And what will happen over here is, look at the diagram carefully. I am turning the baby to this side. No, if I turn the baby to this side, look at the baby's hands over here. On the same side, their baby hand is extending. On contralateral side, the baby undergo flexion. No? On ipsilateral, extension, contralateral, flexion. Ulta will happen in symmetrical tonic neck reflex, that will occur after the birth. STNR will occur after the birth. ATNR will occur before the birth. When does this appear? ATNR, it appears at 35 weeks and it disappears at 6 months. Okay, this is about ATNR. And one more reflex, this is very important, which I am showing in front of you, is This is Moro reflex. So hold the baby in your hand and you just slightly get down of the baby. The baby will be very scary and the baby will abduct and extend the arm. No, the baby will abduct and extend the arms like this, and it also opens the hand. No, that is known as Moro reflex. Abduct the hand, open the arm. No, look at the here what they are doing. The babies, they are just not pull completely. They are keeping the down. They just try to pull the baby down. So the baby is opening the hand, abducting, and to look at the hands over here. It is not closed. It is opened. So abduct. Sorry. Abduct and extend the arm. And the baby, what they will do? They will open the hand. When does this appear and when does this disappear? They will appear at, is very controversial, like 28 to 37 weeks. Okay, and they will disappear by 6 months of age. No, so that's why I thought, which is the very earliest to disappear reflex is rooting reflex. And this Moro is very important. So they will be asking the question like where you will find this abnormal Moro and all, right? Persistent Moro, where you will find this persistent Moro? Generally Moro reflex they will absent at 6 months. If it is persistent, then you can think about cerebral palsy. Okay, exaggerated Moro, where you will see in HIE, hypoxic ischemic encephalopathy stage 1. Okay, and absent Moro, HIE stage 2, stage 3 HIE, and Kernicterus. And in Down syndrome. Down syndrome. Okay, these are all the where you will find the absent Moro. And asymmetrical Moro, Erb's palsy, or in the clavicle fracture. Okay, this is very important neonatal reflexes. I think this will be very helpful for your exams. Like I have concised all the reflexes in the single slide itself. And next, this is the after the birth, Landau reflex will come and parachute reflex. So which I'm look at the over here, there the baby is like this, here the baby is in this. If I will try to pull the down the baby, no, the baby will start opening this. This is known as opening the hands, no. This is known as parachute reflex. And when does this appear? 8 months after birth. After birth reflex. And when does this disappear? Remember, they never disappears. Very important, never disappears. No, so look at the diagram carefully. In this diagram carefully, so like this reflex never ever disappears. That is your parachute reflex, never disappears in the baby, and earliest to disappear is rooting reflexes. Okay, so these are all about neonatal reflexes and developmental milestones. Please go through this very carefully and solve your previous year questions. And next session ours will be on like neonatology. So like I will be covering all the neonatology recent this NRP neonatal resuscitation program updates and all in our next upcoming sessions. So thank you for hearing, guys, and we'll complete the pediatrics, and next we move to the pediatric MCQs, so that it will be very helpful for you and very beneficial for you. Like first you should know theoretically and you should know how to apply that theoretical knowledge to your MCQs. So I will be guiding you and I will be teaching you about how to tackle the MCQs and all. So I think this session will be very helpful for you guys, and thank you for hearing and keep studying.